Hi, my name is Dr. Mary Gingrass, and I'd like to try to answer some of the most common questions I get about breastfeeding and breast implants. One of the most common questions I get is, how soon after breastfeeding can I get my implants? And the answer depends a little bit on each individual woman. So we definitely want to know that your milk has completely dried up, and that may take a little bit different time for different women. So if your breasts aren't changing anymore and you're no longer easily able to express milk, it's definitely okay to start considering going ahead with breast augmentation. So I would say a general rule of thumb is 2 to 3 months after completely finishing with breastfeeding. So ideally, we'd like your breast to be at a stable point, and that applies to weight gain and weight loss as well as breastfeeding. So when should you get a consultation? You can get a consultation when you're still breastfeeding a little bit and you don't have much volume, and that way you're prepared for when the time comes. Basically, there are two groups of women that we're talking about here. The first group has not had a baby yet, and the second group has already had a baby and may have nursed. In women who have not had children yet, we don't know with 100% certainty that you're going to be able to breastfeed, because there are a lot of things that enter into successful breastfeeding. However, a well-executed breast augmentation should not adversely affect your ability to breastfeed. So your breast will start off bigger and will end up bigger when your milk comes in, but the breast implant itself will not interfere with your producing milk or the baby's ability to nurse. The other question I get is from women who've already breastfed, wish to have a breast augmentation, but aren't 100% sure that they're not going to have another baby. So they want to know, listen, I nursed, I really liked nursing, I'm not 100% sure that I'm not going to have another baby, so will I be able to nurse? Well, I can speak to that from personal experience, because I had my breast augmentation at age 40 and then had a little surprise at 43. And I nursed without breast implants and I nursed with breast implants, and really it was not any different at all, except my breasts were bigger. So in the majority of cases, again, a well-executed breast augmentation should not interfere with your ability to breastfeed.